When people do not have religious beliefs, Koenig encourages caregivers to work to understand them and to gently find the reason and time when he or she lost his faith.
And so I try to understand, and I don't try to make the person religious, because you can't make someone religious. They have to want that. They have to be open to it.
Helping a person find meaning and a sense of spirituality can be helpful, but it's important to let their life speak for itself and take its own course. We don't know what is in store for them down the road or how their life might change.
But I won't push them very hard, because I know that there's a lot of pain usually involved in that decision, and many people, they're not done with their life yet. They may change at any time. So there's always hope that the person may find meaning and purpose in their life that transcends their own circumstances, and they may find that in religion, and some may find it in other things.
As a physician, Dr. Koenig deals with the physical and psychological aspects of diseases. However, his effort does not end there. As someone sincerely involved in the well-being of his patients, he inquires about their spiritual struggles, as well as encourages them to reach for the strength in their souls. Dr. Koenig is also involved in scientific research in this area, directs a spiritually focused therapy program, and coordinates with chaplains who have special training in faith support.
In his book, The Healing Power of Faith, How Belief and Prayer Can Help You Triumph Over Disease, Dr. Koenig uses patients' stories to illustrate how faith helps people to cope with disease.
My patients' stories had a lot to do with my going into the area of religion, spirituality, and health. I was interested in how patients were coping with their illness, and therefore I would ask them, what do you do to keep you going? What keeps you going as far as, you've got this severe illness and you've got cancer, or you're disabled. What keeps your spirits up? And then people would talk about their religious faith. And so that's how I became interested.
Alongside his interest in the impact of religious faith on patients' ability to cope with life-threatening illnesses, Dr. Koenig is careful to note that his expertise lies in medical and psychological treatment. He is careful to not overstep what he considers the boundaries of his profession.
My typical session with a patient is really focused on their psychiatric illness, because as a psychiatrist, that's what I do. I don't have any religious training, so that's not what I'm going to focus on. I'm going to focus on their mental illness, the treatments, what the causes.
While Dr. Koenig's expertise is in psychiatry, he finds it important to broaden his understanding of each patient. According to Dr. Koenig, a sincere healer must take additional steps to learn about what makes a person strong and resilient. A significant part of this resiliency comes from a person's cultural, ethnic, and religious background. Often, simply acknowledging and supporting that is enough.
I'm going to try to learn about their religious or spiritual beliefs, and if they have religious beliefs, I may support those beliefs. I will say, well, that's great that you're part of a faith community. Keep it up. Keep it up. That's great. It's good that you have faith in God. That can bring you comfort. So keep it up. I don't tell them to become religious but I will support what the patient tells me helps them. So if the patient tells me their religious faith, prayer, reading the scriptures, helps them, then I will support that and say, that's great. I think, doing that is something that you can do on your own for yourself, and I want you to take the medicine, you take the medicine, you depend on your faith, they work beautifully together. So I want to encourage and support you in doing that.
This approach works well in the work of supporting his patients' healing and recovery. Psychiatric care works effectively in tandem with earnest listening and a genuine attempt to understand a patient's experience.
I do a lot of support. I give medications, too, to people who are very depressed or very anxious. and the medicine seems to help them as well. So I do a lot of supportive therapy as well as prescribing medications, and then I ask people about their spiritual lives, because I think that has a big impact on their ability to cope with their illness and find new meaning in whatever state they may find themselves in.
Dr. Koenig's interest in the interaction between spirituality and health led him to research and training in that area. He now directs Duke University's Center for the Study of Religion, Spirituality, and Health. The center conducts research and training to enable healthcare providers to integrate spiritual understanding and support into their medical practice.
We have a Center for the Study of Religion, Spirituality, and Health here at Duke University Medical Center. And this is a center that focuses on research, conducting research, and in advising others to do research, and also supporting research through grants. And it's also focused on training people to conduct research, teaching them how to go about measuring and studying and applying the scientific method to the looking at the relationship between religion and health. We also are very interested in teaching clinicians, doctors, nurses, social workers, how to apply the findings from research to their clinical practice.
According to Dr. Koenig, one of the reasons that poor health and spirituality seem to go hand in hand is the very nature of illness. Ordinary daily life does not permit one time to think about the deeper questions of existence. When sickness brings a halt to ordinary life, people find that they have the time to think about health, prayer, faith, God, and life after death.
And our studies show that, at least in the southern United States here, the southeast, 90% of people begin to think about these issues when they get sick and in the hospital. 9 out of 10 patients are in some way thinking about it, and even if they're not consciously thinking about it, it's happening to some degree unconsciously, because you can't face death and potential disability without wondering what's ahead. I mean, that's just not human. It's human to question and to try to understand where you're going, why you're here, and what purpose your life serves. It's just human. You can't escape it.
According to Dr. Koenig, it's important to recognize the value of listening to and supporting the spiritual stories told by patients. However, we must recognize that the acknowledgement of spiritual needs requires a different type of expertise than many medical staff have. In keeping with Dr. Koenig's own sense of boundaries between his support of patient spirituality and his own area of psychiatric expertise, the Duke Medical Center established the chaplaincy service. Chaplains receive specialized education from organizations such as the Association for Clinical Pastoral Education. In the U.S., many hospitals and hospices employ chaplains to assist with the spiritual needs of patients, families, and staff.